Welcome, listeners. In this episode, we'll talk with my dad about the decision making process behind sending me and my sister to medical school in the Philippines. We'll dive into what factors mattered most to him as a parent and how other parents can think about this choice. So, I want to welcome everyone. This is my dad here.
Hello. Hi. Good afternoon.
Yeah, before we start this interview, you want to introduce yourself, what you're doing right now?
First of all, I'm a graduate in the Philippines, having this medical degree in 1986 at Far Eastern University, Dr. Nicanor Medical Foundation. I moved here in the US in 1999. I did practice medicine in the Philippines as a radiologist from 1991 until early of 1999. So I started from scratch, working as a ultrasound technologist. I took the exam while working, then passed all the three required exam by USMLE, and I was able to train in 2003 to 2006 in Buffalo, New York. And I have been practicing internal medicine for the last 16 years. It's hard, but with perseverance, thinking about my family, I need to do something to improve the quality of living here in the US. It's hard, but it's doable.
Just like a little breakdown is you graduated medical school in the Philippines and you practiced there as a radiologist for a
Yes.
number of years before moving to the United States,
Yes.
and you worked to become a licensed physician here in the US. So before you became a licensed physician here in the US, you were an ultrasound technician for
Yes.
a couple of
For
years.
about almost going 4 years, I think.
Okay. And then you took the step one,
Step
step three. You went to residency again, right? This is your second time going into residency, right?
yeah, but it's a lot different because radiologist deals more with films and procedures, but we don't have the much clinical experience.
Mhm.
That's how it is. It's
Yeah.
a lot different from what I was able to accomplish here in the US.
Yeah. So you didn't become a radiologist again.
I tried, but
Mm.
it's difficult because it's one of the most competitive specialty here in the
One of
US.
the top four most
And the
competitive.
tough specialties. Usually local graduates want this high salary without much clinical.
Procedural work.
It's more procedures and treatment as well when you go into interventional radiology.
But you became an internal medicine IM doctor. Is that correct?
Yes.
Okay. Yeah. I just wanted to lay out what struggles and what accomplishments you've already have gone through. A testimonial where you can become a licensed physician even after so many years of going through medical school in the Philippines. That's amazing. Thank you for your introduction. Let's just jump into the questions here. So, the first one is, what made you consider the Philippines as an option for your children's medical education? How did you know that studying medicine in the Philippines was an option?
First, even before we go into this interview, you have to ask your son or daughter if they really want to be a doctor.
Yeah.
That's the most important requirement. You cannot just push them to go to healthcare without asking them first because it's
Mhm.
hard. It's
Yeah.
hard. Then you have to ask also whether they want to do the schooling here in the US or not. If they do, then you have to tell them about the expenses that they have to apply for loans. I know even though I'm a doctor here, it's not enough to support them 100% because even though we're in the high income salary, usually Uncle Sam takes
Okay.
almost half
Mm.
of what you're earning. So I offered the option to my daughter. If she wants to study here, then go for it. But if she doesn't want to have loan here, then probably a good option is to go abroad, like in the Philippines where I graduated. The advantage of sending your son or daughter to the Philippines, it's the affordability. Usually, the range of tuition fees is something like 3,000 to 6,000 a year, while here in the US, something like 50,000 per semester or a year. So you have to do the math and you can see a lot of difference. It's only about 1/10 of what you're gonna spend
Yeah.
in the Philippines as compared in the US.
So the difference in affordability is
Yeah.
extremely significant, you would say.
It is
Yeah.
very extremely
Because I think just from the numbers alone, that's 10%.
Yeah.
And I would say $200,000 in medical school here in the US is
Not
on the lower range.
the lower range. I have talked to some of my co-residents when we were having some chat with regards to how much I owed and how much they owed.
Yeah.
And usually they will be surprised when they ask me how much I owe. I will tell them this, zero. While them, they will tell me that they owe something like 300 to 500,000. And they were really surprised. And
I
yeah, I
think
was,
that's what catches a lot of local grads say, oh, yeah, I have a lot of loans to pay off.
yeah,
And then they ask you, it's nothing.
yeah,
Yeah.
nothing, zero.
And that's pretty amazing. Yeah, just to sum up, first of all, you need to make sure your child wants to go through medical school.
It's not an easy profession. You know?
Definitely not.
It's
Not easy.
It's a vocation that you have to deal with a diverse population, and you have to have the heart to diagnose and treat patients. You have to be compassionate, have empathy.
Yeah,
You know, that's how
it's very difficult. Yeah, medical school is just a whole different thing. So other than cost, is there anything else that you think that made you consider?
the level of education in the Philippines is recognized globally, like in World Health Organization, even the EZFMG. The curriculum is usually based here in the US. It's not much different. And the other thing is the primary teaching is English. You eliminate language barrier. Every single Filipino in the Philippines, usually they spoke English language. So it will be a lot easier for international students to come in the Philippines. That's the other advantage that I can see in the Philippines.
So the school I went to, UST, that is ECFMG recognized.
Nice.
So you are able to apply into residency as long as you fill out the other requirements that ECFMG requires, such as step 1, step 2, step 3, some clinical exposure, and English proficiency examination as
you
well.
have to.
And that's pretty straightforward. That's not difficult. The step 1, step 2, and step 3, that is difficult.
As
is
when I was doing the exam during the early 2000, we have the clinical skill assessment too.
Oh,
It's like a practical exam that you have to get the history and physical examination of at least 11 actors or actresses.
but that now is
Now it's
no longer clinical skills assessment,
Yeah.
CSA, is no longer required. And then another thing you touched on was that the schools in medical school in the Philippines,
Okay.
they globally recognized, and they also teach in English, which is another huge factor. If you're going from America to the Philippines and they teach in English, you can definitely follow along. I will say when I went to medical school in the Philippines, it was mainly English. They will still speak in Tagalog. It's more of Taglish, but you can understand fully what they are teaching 100%. So I think that makes the transition a lot easier.
a
As
lot
you had
easier. And the other thing that you can add because of the cultural adaptability, especially as Filipinos, we usually instill to our children with regards to our culture, but it will easy for them to adapt. But some of the children that grew up here, probably they will have a hard time, but it'll take them probably from 6 months to 1 year.
Yeah, I will say probably the hardest part when I went to medical school in the Philippines is that initial adjustment period. It is a culture shock. It's a whole different culture to experience because everyone is Filipino there. They have a different way of doing everything.
Yes.
Even their humor is different.
Yeah.
So it's definitely very helpful to know Tagalog or even understand Tagalog.
Yes.
For me, I understand Tagalog, but my speaking of Tagalog is not the
Worst.
greatest. It's not.
Okay.
horrible.
But you can definitely, konti lang, but they will know right away if you're a foreign grad or not in the Philippines.
They will know 100%. But I tried my best and they appreciated that. They definitely appreciated me at least.
And locals usually, they are fond of film.
What do you mean
actually.
by that?
It could either be fun or somewhat intimidated by the films,
Oh, yeah,
but
yeah.
they love to mingle with international graduates. Based from my experience when I was in med school before, because we don't only have Philams, but we do have Americans, poor Caucasian,
Mhm.
and we do have some African American as well.
Right.
And we love to have conversation with them with regards to the way of life in the US.
Yeah, they're
Yeah,
very curious.
they are curious to us being Filipino, and we are also curious to them with regards to being of different ethnicity.
And they just want to get to know you. And Filipino people are known to be one of the friendliest people. It's just even more so in the
Yeah,
Philippines itself. So
it's a good
Mhm.
interaction.
I met some of my greatest friends in the Philippines, honestly.
Yeah.
So they're very friendly, incredibly smart too. My goodness, incredibly smart.
And the other thing that I forgot
Mm,
to
yeah.
say, I think, because in the Philippines, the method of teaching now is more of integrated. Meaning before when we were in first year, we just memorize with regards to anatomy, physiology. But now it's integrated. They correlate it already with the clinical cases.
Yeah, it's clinical correlation. That's what they
Yeah.
teach. So when you're learning anatomy, they'll tell you, okay, why is this structure important?
Yeah, because
Right.
before it was
Mhm.
just you just memorize all the different parts of the body, anatomy,
Right.
histology. But now when I talk to you, Crisel and Carlo, yeah, the teaching is more of clinical correlation with
Mhm.
regards to anatomy, physiology, chemistry. That's why I was surprised when I was talking to them. They know some of the clinical aspect of the first 2 years in medical school.
Yeah, I
So
think
that is good.
when I was learning physiology, I think I called you. It was about the skin. I don't
Yeah.
know if you remember that.
I don't know if I can remember that, but Crisel has a lot of questions with
Yeah.
regards to clinical,
Yeah.
even though she's only first year and second year.
Okay. Yeah. It's a great input. Next question would be, what were your biggest concerns at the start for your kids?
Well, my biggest concern first is can they adapt easily with how the teaching is in the Philippines? Because it's a lot different. Just like the way they study in the Philippines is a lot different here.
Yeah, I agree.
In here, I think I don't know, but we study a lot, read books. Then we have exams, two, three exams in one day. That's the other thing. Here, it's more of layback with regards to teaching. Is that right? Or
I
no?
would say it's a mixture of you're in medical school
Mm.
because there is just a lot of things to learn in medical
Mm.
school. But the teaching is definitely very different because you have to consume so much information and be able to answer through quizzes and
Yeah.
tests and standardized examinations. So you do have to work a lot more. I don't know whether it's the Philippine system. It is probably because of the Philippine system. They have very high expectations, and the students you'll be learning with have very high
Yeah.
expectations on
They're
them. Yeah.
very competitive. They ask your grades or something,
Mhm.
which here in the US, they don't even ask you anything about what your score is.
Everyone is great conscious.
Yeah,
Yeah.
no, in the Philippines,
Mhm.
everybody's conscious. They want to compete with you.
Yeah. I remember my peers, they were nurses, Ts, psychologists, clinical lab techs. So they have a very good background. Forgot to include pharmacists as well. They
Yeah.
have a very good medical background. So they have that good foundation. And although they're competitive, I will say they're also
Mm.
very helpful.
Yeah.
Yes. That's actually how
That's,
I
a,
feel I passed most of the
that's how
exams and
Filipinos
tests.
are
Yeah.
very helpful. They are not selfish. They help each and every friends that they can help.
I actually think that's a very important factor in
Yeah.
adjusting. You need to make friends.
Yeah, that's the number one
Mhm.
thing that you have to make friends with people.
Yeah.
For me, that's one of my concern because as Carlo is somewhat different as compared to his siblings, as he's somewhat introvert. But I was happy to learn that he made a lot of good friends, was able to finish med school without much of my help. Unlike your sister, I've been calling her almost every single day just to make sure that she's doing okay, she's adjusting well, school friends. That's it.
Yeah. What's interesting is I was an introvert, right?
Yeah.
But one of my first goals when going to the Philippines was to make friends because
Yes.
I didn't think I would be able to make it without knowing people or getting help from other people.
Their way of life is a lot different from the US.
Yeah, yeah. That was my biggest priority when first going to medical school in the Philippines. Get to know everyone.
Yeah.
I think it was a very good strategy, at least for me. Could be different. I know Chriselle had a different strategy. She was
Yeah.
extremely studious. Me, hey, I'm here.
But
Mhm.
you were able to do it.
Yeah.
I'm happy and very proud of you.
Thank you.
So what else? I have to tell my daughter Crisel about the security and criminality in the Philippines. I advise her not to show off or wear these branded bags or shirt or whatever.
You're talking about safety.
Yeah, safety,
Uh-huh.
and awareness of
Right.
the criminality in the Philippines. That's why I try to tell her to just lie low with regards to wearing things or bringing things. But it's funny when my daughter was saying that her first day in attending a orientation, and she brought with her a bag which is just like a shopping bag, and everybody was looking at her, and she didn't even talk to anyone, and I think they were trying to belittle her that that's just a scholar from the province.
And so you think Chriselle went a little overboard?
But it's okay. But when they learned that she speaks straight English, she
They're
made a lot of
surprised.
friends. They
Yeah.
were surprised.
Actually, that is one of the surprising things is in the Philippines, a lot of med students are quite well off, especially the med school I went to, UST. They were pretty well off, honestly. They would have a lot of designer bags or have
Yes.
nice jewelries on. But if you really do want to avoid like security risks or
Yeah.
theft,
You
definitely
have to
don't show
be
off.
just be simple and concentrate more on your studies. That's how it is there.
Like the school of UST, FEU, it really is in the heart of Manila.
Yeah.
And cities are well known for those type of
Robbery,
robberies. It can happen. Personally,
snatching.
snatching,
It's
yeah,
not only in the Philippines,
not
it's
only in
all
the
over the
Philippines.
world. Just to be on the safe side, just lie low and don't wear things that will attract snatchers, holders. That's how it is.
For me, I personally never experienced any of that type of
Mhm.
things, but I did see some. You'd hear things like, "Oh, I had my phone out, and all of a sudden a motorcycle came, snatched my phone." I have definitely heard of that, but it never happened to me. Experiences are a little different.
Yeah.
As long as you surround yourself with a good crowd, it reduces the chance of you getting robbed. I won't say it's zero, but it definitely reduces it. Is there any other concern you had?
Of course, the distance and communication because we're a close family that we see our kids all the time in the house. With our kids sending to the Philippines, distance and communication is also a factor. But with the advent of social media, and it's for free, we can talk to them on a regular basis, FaceTime them, Messenger them, or what else, even Instagram, right? So that's the big advantage of having the social media.
That is true. You're a whole
Yeah.
sea away. So it definitely is a
That
natural
helps with
concern.
regards to the psychological, the sadness,
Yeah.
depression, anxiety. You can give moral support when you talk to them.
Yeah, it's definitely part of a whole change or shock when you first move
Yeah.
because you're going to be away from your family. But just keep in mind there are ways to mitigate those type of concerns. Calling your child is definitely helpful to their mental health. Keep close contact and you should be perfectly fine.
I'm not concerned much of the quality of education. It is one of the recognized institution in medicine in the Philippines.
There's actually a lot of people that
Yeah.
graduate from UST that
Yeah.
work here in the US.
So I'm not
Yeah.
worried about the quality of education that they're gonna receive at US. And I also know that I think even Crisel told me if you have some issues with regards to academic support, they have this student council, not only for locals, but also for international graduates, wherein they can talk to each other. What are their problems or issues? Yeah, Crisel have told me about some of the support that she's getting from this film support.
So I can comment on this. When I was doing my medical school, we had a group. We had called ourselves the Philams, so the Filipino Americans, where we would check in on each other to
Yeah.
make sure that we are keeping up with our studies. We're adjusting
Yes,
perfectly
yes.
fine. It's hard if you're
Yeah.
alone.
Yeah, the higher years, they can
Yeah.
tell you
You
what to
know,
do, how to adjust. The other thing is
time management.
time management is a
Mhm.
very important thing because here in the Philippines, you'll have an exam ranges from 2 to 3 a day. Sometimes no sleep.
10 times no sleep, but that's medical school in a
Yeah,
nutshell. But yeah, there is support groups for helping you adjust to medical school in the Philippines. They're there to help you, and you're there to help them as well. It's a
yeah.
team effort to make sure everyone makes it to the end.
What else? Financial concerns.
Other than
Uh,
tuition fees, I think
yeah,
we should also cover
the
housing.
food, it's a lot cheaper,
A
living
lot
in the
cheaper, a
Philippines.
lot significantly cheaper.
And the food, I think, better or more choices.
Depends. It depends.
Depends, but to me, more diverse with regards to food in the Philippines.
Okay, so that's one thing I will say. The Filipino food, of course, any Asian food in the Philippines, it's going to be better. But let's say Mexican food, it's not the best. I think it's just
I
very straight up. It's not the best. But they're very good options, honestly. Yeah. And money wise, an average meal ranges from $1 to $2. And if you want it delivered,
yeah.
that's an extra 50 cents. If you want to go somewhere, we don't have Uber there. It's called Grab.
Mm.
And I think the most expensive fare I've paid,
How
that was like a
much?
1.5 hour, just because of traffic. It was like $10.
That's the only setback as well.
So,
Traffic in the Philippines. And the weather, of course.
yeah, it's
It's
hot.
kind of humid and hot.
It's near the equator.
Yeah.
It's an island next to the sea, so it's very humid.
I think the classroom in UST are aircon, right?
There are air
So,
conditioning. Yeah, what you'll find yourself doing is you'll go from one room and then walk very quickly to the next. So,
Sooner or later, you will acclimatize with the weather.
yeah, you can definitely mitigate some of those factors, making sure you wear moisture wicking clothing. It's very, very helpful. Okay, so next question is, I think we actually covered this. How did you compare the US versus Philippine med schools path in terms of time, money, and opportunity?
As I said earlier, the quality of education that they get in the Philippines is at par with the medical school here in the US. If you have a good basic knowledge of the medicine, you can compete anywhere. Yeah, and the other thing is, the advantage of being the Philippines is very affordable as compared here in the US.
We touched on
Yeah.
this quite a lot.
And as long as your kids is really willing to be a doctor here in the US, they can pass the USMLE as
Right.
long they persevere and don't give up. What do you think?
No, I agree. I
Yeah.
agree. If they really wanted to pursue medicine,
Yeah.
one affordable
Yeah.
option,
You-
Philippines is a great
If I can do it,
choice.
when I was old, I started reviewing and taking the exam for USMLE. I was already 43.
43. How many years were you past med school?
Med school,
Yeah. How many years?
pass
8, 10 years?
no licenses as to practice in the Philippines,
Right.
88. Then I started
Step
passing
one,
the
step two.
exam in 2001 and 2002. That's how many years.
Yeah.
I don't have good clinical exposure in the
Right,
Philippines. I'm
right.
just plain and simple radiologist.
So yeah, just to slowly cover is step one and step two is pretty much the foundations of what you learn in medical school.
So you have to have a good basic in first year and second year.
Okay. Would you say the opportunities is harder or more difficult that you went through the Philippines?
Let's compare here in the US. Of course, local graduates are the first citizen to get into residency because
Right.
they're local graduates. And us
That's
are considered the second citizen.
Mhm.
So it's harder, but it's still doable. And there's a lot of needs for doctors in the US. As I heard, I think this year, there's a lot of unfilled positions.
Yes, that's very true.
Yeah.
numbers wise, it's interesting that people say that it's hard for international graduates to get into residency here in the US. But in fact, a lot of residency positions here in the US go unfilled.
Yeah.
So the top two spots that are go unfilled is internal medicine and family medicine. You can even see sometimes in emergency, those positions go unfilled. So right now the US is in a shortage of doctors. But to go back, right? There are positions, many
A
positions
lot of
that
positions, as long as you don't give up. If you fail one, you can fail two, and you can
right.
still keep trying. That's how it is. You have to persevere.
Sure.
Whatever the debacles are, you still have to study harder, maybe. What's the other thing that I think the advantage of being a local graduate here in the US because of probably exposure to the technical aspect of EMR. They follow the standard operating procedure for all cases. Like in the Philippines, we usually use our clinical eye to diagnose and treat the patient and order just a simple lab test. That's the thing. Because
Yeah.
most of our patients in the Philippines have a low socioeconomic status.
That's actually an interesting point because in the Philippines, you can't just order
A lot of
a
tests.
lot of tests.
You just have to
Yeah.
order the necessary tests.
Only what your clinical eye
Yeah.
sees what is
Mhm.
needed. Here in the US, you do learn, hey, these are the standardized tests
Yeah.
that you should always order for the patient. It'll always just be a battery. But in the Philippines, it's okay. They have diabetes.
Yeah.
You need your glucose and your HbA1c. Everything else is you have to be sure. So that's just an example.
Especially in the Philippines, my experience, probably you have also experienced that most of the handling patient is more hands-on and not only deals with the patient itself, but with the family itself. You develop your empathy. Sometimes you feel what the patient and family was feeling about their sickness,
I definitely agree
right?
with that. Yeah, you experience a lot more in the Philippines, actually. Just a comment is that when I came here and learned more about the whole system, during my internship, I actually did a lot of what the nurses would do here. And that gave me an interesting perspective of how much nurses do
Mm.
and the amount of things, the amount of annoying things that they have to go through. And it's interesting because a lot of doctors that did local medicine here, they don't have that experience.
Hands-on in the Philippines.
Mhm.
You know, in here you have to be with your seniors to do IV suturing
Right.
before you get credential and do it on your own.
For sure.
But in the
Yeah.
Philippines, they will just let you
For the good or
do
the
it.
bad. But they need
Yeah.
help. There's a lot of people that need help in the Philippines, for sure. Okay. What finally convinced you that this was the right decision?
For my kid to go to the Philippines, I think we covered it already, right?
Yeah. Okay. Yeah, for
So
sure.
I think number one, of course,
Price,
the
affordability,
the kid, the willing to go to med school, put in the work only
time.
by verbally or something, but they
Mhm.
have to have the heart to be one of us. Then, of course, affordability and the quality of education, which is at par here in the US. And what else? And of course, the primary method of teaching is English.
Yeah. Okay. English.
And schools are a lot of schools in the Philippines are world recognized by World Health Organization and even ECFMC. So all the teaching they can probably easily pass USMLE 1,
Me too.
USMLE 2,
Yeah.
and
Yeah.
even 3.
Okay. So, what advice would you give parents currently weighing this choice?
If your son or daughter asks you or tell you that they're going to med school, if they wanted here locally, then go for it. Just tell them about how much it will cost. In here, as long as the child is willing to study any course, they can apply for loan here. As long as you don't just focus on sending them to the Philippines. If they want here, do it here. If they wanted to,
Right.
as long as they're willing to apply for loan. That's the thing. And if they don't know about going to med school in the Philippines, probably you can tell them an option. affordable, high quality education, Philippines is a good option.
Yeah, it's a great
Yeah,
option. It's also a
yeah.
great experience too.
And the other thing that the parent can do is to probably tell your son or daughter to contact some of your friends who were able to be a doctor here in the Philippines, their experience, and even go to websites that will help them realize there is a better option as compared to locally. So, yeah, why not?
Yeah.
Yeah. I have grandkids. If I were to advise them, if they don't want to have a loan, then probably I will keep telling them about the Philippines,
Yeah, for sure.
about the affordable, good quality education in medicine. That's how it is.
All right. That concludes our interview with my dad. Thank you so much for your time.
Oh, thank you,
Um,
man.
okay, yeah, for sure. Just to summarize, parents face big uncertainties when thinking of sending their child abroad. This episode shows that choosing the Philippines is not a second best, but a strategic move, and how parents can move from doubt to confidence. If you are curious about going to medical school in the Philippines, contact one of us or go to check out our website on phpathwaymd.com. Maybe consider scheduling a consultation with us. All right. Thank you so much. Bye bye.
Bye. Okay ba yung